Hello, students and professor. My name is Ashlyn Hernandez, and the topic that I've chosen for my presentation is Marfan syndrome awareness. I've chosen this topic because after speaking with professors, speaking with various people, most people that I spoke about do not know what Marfan syndrome is or its symptoms. I consider this a very important topic to tackle because having Marfan syndrome can be deadly. Throughout this presentation, I will present what is Marfan syndrome, its symptoms, how does it affect the people that have it, why should there be Marfan awareness, and if there are any foundations that actually help people with Marfan. So without further ado, let's start with this presentation. So let's start off with the most important thing. What exactly is Marfan syndrome? Well, Marfan syndrome is an autosomal dominant condition that targets the connective tissue, subsequently causing troubles in various areas of the body. This condition actually begins with a spontaneous mutation in TGF-beta R1, 2, or fibrillin. In many cases, this can actually be inherited from parents, though most cases that have been recorded, it's because of a spontaneous mutation. This mutation occurs in different areas, so it's very difficult to actually determine the area in which this mutation can happen. A question or doubt that may arise is that how this being a dominant condition is not present in the population. Well, dominant does not mean it has to be present in the population. It simply means that it's easier for it to be inherited or passed down through generations, whether the parent is homozygous or heterozygous. Regardless, that gene will always be present, and there will be a higher chance of this being passed down. Unlike recessive conditions or recessive traits, which are a little bit harder to be passed down. There needs to be a specific combination for a recessive trait to be passed down. So, as previously mentioned, Marfan does target various areas of the body. These include the connective system, visual, skeletal, and in very severe cases, the heart. Targeting other areas as well. These are the ones of more importance. It can actually affect the respiratory system. It can affect many other parts of the body because, as I already said, it affects the connective tissue. Now, tackling the symptoms of Marfan targeting the proper formation of connective tissues will present various and many symptoms. Marfan diagnosis can actually start off with visual problems such as severe myopia, lens dislocation, and retinal tear. Later on, because of these symptoms, it can be referred, patients can be referred to other doctors to verify other symptoms of Marfan, such as scoliosis, and it can be seen externally the malformation of the rib cage. The rib cage in Marfan patients tend to sink, and it can affect the respiratory system. Some of these symptoms, as I previously mentioned, can be externally viewed. Marfan patients have very specific characteristics that can aid in the diagnosis of Marfan, but not lead to a specific diagnosis, because Marfan is not the only condition that actually has these same symptoms. There are other conditions related to Marfan that have the same symptoms, but it's not exactly Marfan. So these external symptoms or characteristics are abnormally long limbs and a very high stature at a very young age, meaning that children start to grow abnormally fast, but they're not developing properly. Scoliosis is one of these key things or symptoms to watch out for, as I previously mentioned. Another characteristic, or it's more of a home test that people do on their own to see if they actually are Marfan patients. It's checking out if they have arachnodactyly. This is the ability to bend back your fingers, to your fingers being very much longer than your palm of your hand, or also being able to wrap your fingers around your wrist, mostly because it's very thin. One of the most prominent characteristics that will actually make doctors go, your child needs to be diagnosed for Marfan, is the sunken rib cage. Many adults, for some reason, choose to ignore this when they become adults, and this can actually cause problems in the respiratory system, causing pressure in the lungs and making breathing very difficult. Marfan is divided in different severeness. The most severe case of Marfan will include all of these symptoms, but with the additional risk of thoracic aortic aneurysm, meaning that the aorta of the patient will dilate and weaken. How does Marfan affect those that have it? Marfan poses a threat to both currently diagnosed patients, possible patients, and people that don't have a clue that they have this condition. Marfan patients will be restricted from performing any kind of exhausting sports or activities that may cause a stress to the respiratory system or to the heart. Many of the diagnosed patients are children. Now, in children, they tend to be very active and will always aspire to play sports. But the sad case for children diagnosed with Marfan is that they will not be able to perform sports like football, soccer, basketball, volleyball, due to the stress that it can cause to the heart if they are on the severe side of Marfan. As previously mentioned, Marfan varies between mild to severe cases, the most severe case including aortic dilatation. This is very dangerous for patients if they are going on about with sports and such. Aortic dilatation is the biggest risk of death in patients. Aortic dilatation means that the aorta begins to dilate, making it weaker with every centimeter or inch it dilates. It will cause alarm when the vulvasa exceeds 5 centimeters or 1.5 centimeters per year. This can also cause an aneurysm. An aneurysm is a bump formed in the aorta in which the blood will sort of go towards that way. The blood flow will take a detour, and the aneurysm, that part is extremely weak. The risk of death is because the aorta, if it dilates so much, it pumping blood or a patient getting very stressed, the aorta can actually burst. Patients are given blood thinners to help in this case, but there are times in which there's no other way and an emergency surgery must be performed. In the images presented here, you can see a normal aorta versus an enlarged aorta and the aneurysm and how the blood can actually go into the aneurysm. So the question that needs to be answered is, why should there be Marfan awareness? Though Marfan only affects 1 in 10 to 20,000 cases, there comes a moment when a Marfan diagnosis comes as quite the shocker to both parents and the patient due to the little awareness. The Marfan Foundation is in charge of spreading the word concerning Marfan. They work alongside researchers and doctors to aid in the spreading of awareness. Medical professionals that are not involved with the Marfan Foundation or are not familiar with Marfan syndrome are quite ignorant when it comes to this disease. At times, they're obligated to deny treatment due to not knowing how to treat it appropriately. Professionals in the field of genetics have also found themselves pretty perplexed about Marfan and how unknown it is. In various interviews that I conducted, I was told that paramedics and doctors have denied treatment to young people because they don't know what Marfan is and they don't know how to handle it. And this is really concerning. Are there any Marfan associations or foundation? Yes, there is. As previously mentioned, the Marfan Foundation is the only foundation that works on raising awareness alongside smaller associations throughout the country. The Marfan Foundation was founded in the year 1981 when Marfan and other related diseases were very unknown. Thus, as they began to grow, their mission was established. Their mission is to create a brighter future for everyone living with Marfan syndrome and related disorders. They also hope to provide proper funding to any and all Marfan related researches. Their sole purpose is to make sure that everyone that has Marfan or any related disease to be properly diagnosed and get the treatment that they deserve. Sadly, in Puerto Rico, there are no Marfan associations. This is really concerning. Only a handful of doctors and people are directly in contact with the Marfan Foundation. This is something that I found out after speaking with somebody directly from the Marfan Foundation. Though there are no exact numbers of Marfan patients in Puerto Rico, the ones that have been diagnosed seek treatment in the United States. Most surgeries for scoliosis get done over there for those with Marfan. Now, finally, my question to you is why should you care about Marfan? Well, it's simple. Marfan can affect anyone. As I've been saying throughout this presentation, Marfan can be both inherited from a homozygous or a heterozygous parent, but it can also be a spontaneous mutation. It can start with a person and that person will pass it down to their family. Marfan does not distinguish between race nor gender. Knowing about Marfan can save a life, and it can open a door for many future researchers to work their way into finding methods or new ways to aid Marfan patients. Marfan is very real. It's something that both professionals and students should be aware that exists. And after conducting many interviews, I was quite surprised to learn that many medical professionals don't know about it. People that are trained to diagnose, to help people with diseases and such, they don't know what it is. It can affect your friend, it can affect a family member, it can even affect your future children. It is important to not hesitate to point out to someone if they have apparent Marfan syndrome signs. That way, you can make sure that the person gets properly diagnosed before anything serious happens. It's very important to keep this in mind. And if you see a child with signs of Marfan, don't hesitate to talk to their parents and tell them what Marfan is. Now you know what Marfan is, how it affects people, and how deadly it can be. Imagine if because you were too scared to point it out to someone. Somebody lost their life, your friend or a family member. It's very important to tackle this. This is the end of my presentation. I hope you enjoyed it, and thank you so much for your attention.